And there's enough potential there in that pool of money that we don't have to have the government run it. What, in fact, we can do is we can create and allow that money for everybody to have the kind of access that Senator Murray wants that individual to have. The thing that I think is draws us apart is the level of involvement in the government in making those choices. And I would just put forward to you that we ought to have another talk like this as we can get closer and closer on some ideas, because we all want the same thing, but how we get there, whether or not we're in charge of it or the individual patient's in charge of it, personally making their own choices with the asset value that is capable based on what we're already spending in healthcare. We don't need to spend a penny more in healthcare in this country. What we need to do is spend it much more wisely and much more effectively.
Okay. I'll pick up on some themes in my close. Charlie Rangel.
Thank you, Mr. President, and I appreciate the fact that you saved the best for last.
Absolutely.
I had really hoped that when we came here that we were really going to push over the top. We are so close to what could happen to them when they lose their job. And I think one of the big problems America would have is, why does it take 60 to get a majority? And I have to explain, well, that's the Senate, and they're different than most Americans in understanding it. So what I would hope would happen is that we leave here not thinking that we're going to start all over. We can't get back those times. This is the last year for a whole lot of people in the House of Representatives who we believe we represent the people too. Why can't we take what we've agreed to? I mean, sick people, scared people are not Republican and Democrats, they're Americans. And you've made it abundantly clear that you have the same sensitivity, you recognize the fiscal crisis, you know what can happen to our country if we're not educated, if we're not strong in a healthy way. Have staff or somebody bring together those issues that cannot be contradicted in terms of what you want. And I know you want more than just 3 million people. In short, you can explain why it's difficult for you to do it. But I know you would want to achieve having most all Americans or all Americans with the same health benefits, because that's so important. And then, Mr. President, after we start learning to agree with each other, and it's not a question of no, but it's the Congress working its will for the good of people, then we can work out, and God knows Mr. Kemp and I have tried desperately hard, and Jim McCreary before him, to realize people aren't concerned with the debate. They're concerned with what are we going to produce. And I don't care what your color is, I don't care what your party is, that if you're sick and you don't check out the doctor. And they're not going to check out whether or not you're Republican or Democrat. So I just hope that we can change this to a positive thing where you can say, let's leave here at least talking about what we agree on. Let's stop knocking each other as who's the smartest and who's the most patriotic. And let's really then confine the public argument to where we disagree. And rest assured, I can assure you that they won't be concerned with how big the bill was. I have no clue as to how big the Social Security bill was, how large, how many pages was in the Medicare bill. And I don't really think that someone sick in the emergency room is concerned about the size of the bill that we are trying to help them with. So I appreciate this. And
John Dingell.
Mr. President, thank you. And God bless you for your leadership in this matter. The country desperately needs you and desperately needs this legislation. I saw a cartoon. Two people are sitting down, and one of them says, terrible news. Our health care rates are going to go up 40%. The other guy says, don't worry. Good news is you're not concerned because you have pre-existing conditions. This solves both problems, the bill. And Mr. President, again, we desperately need your lead. Now, having said that, when my dad started out on this years ago, Harry Truman said, you know the reason people don't have health care in this country? They can't afford it. And he was right. And it's still the case today. I saw this morning a statement that was made with regard to starting over. This comes from a respected Republican leader, Governor Schwarzenegger, California, February 23rd, 2010. I think any Republican that says you should start from scratch, I think that's bogus talk and that's partisan talk. I think we need to buckle down and get to the business of solving the biggest problem that this country has coming down the road at us. In 2025, the cost of a family's health insurance is going to double. $25,000. I don't know anybody can afford that. You can argue about Cadillac plans and other nonsense. That's not going to be important. And in 2080, the cost of all of our health care is going to equal the gross domestic product. It's a recipe for disaster. We have much in common, I want you to know, and I hope and pray you'll take a look. We cover young adults under their parents' insurance. That's a Republican offer. We prohibit dropping insurance coverage when the patient gets sick, but we don't. And the Republicans do too, but they don't cover pre-existing conditions. Both of us prohibit annual and lifetime limits. High-risk pools we have and they have. But high-risk pools carry with them some risk because it constitutes an incentive for a race to the bottom, whereby people will move their insurance companies to a place where they have the least regulation and the least protection for the consumers. And it also includes, and amongst the other 14 items where we're agreed on, is the availability of health savings accounts. There are a lot of other things here that we have and we need. I would say that I've seen some of my friends who I knew before they were virgins. They were pushing, for example, use of the extraordinary budgetary mechanism, and as